Hi, thanks for clicking on the link to the video for NCR Anatomy and NCR Technique. I'm Ian Headley. I'm the UK's first fully certified NCR therapist, having trained under the developer, Dr. Dean Howell, at the NCR Research Institute in San Diego, California. So I wanted to talk just briefly about the anatomy and the technique that we utilise in an NCR treatment series. So NCR is a cranial therapy. Now the human skull isn't one solid piece of bone. It's actually made up of 22 interlocking bones that are joined together at what we call sutures or joints. Now, despite what's written in some of the old anatomy textbooks, the joints or sutures between the cranial bones allow a certain degree of movement, and we call this micromotion. So this has been theorized and hypothesized for well over 100 years, and it was proven beyond any reasonable doubt in the 1960s by a team of osteopathic researchers that used very sensitive receptors on patients' heads and found that the cranial bones and the sutures actually allowed movement during chewing, biting and swallowing. So the sutures are almost like nature's way of allowing the skull to move, and then the fluid that bathes the brain within the skull, the cerebral spinal fluid, to flow properly, which allows the toxins to be removed from the brain and the nutrients that the brain needs and needs to be nourished by, allows them in. So the human skull, it's 22 bones that are all interlocked, and the central bone of the human skull is called the sphenoid bone. Now the sphenoid bone is a butterfly or bow tie shaped bone that runs behind the nose and at the back and the top of the throat. Now the sphenoid bone is quite deep set within the human skull, and it's quite difficult to access. So the only way you can reach it with your hands or your fingers is to place them here on the human skull, where you're accessing the greater wings of the sphenoid bone. But the main body of the sphenoid bone is inaccessible, and it's much deeper within the human skull. Now the sphenoid bone is kind of like a keystone or a cornerstone to the human skull, and it articulates with 19 of the other 22 cranial bones. So if you can move or manipulate the sphenoid, you can move all the other cranial bones into a more symmetrical alignment pattern. Now also within the skull there is something called the dural membrane, which is a thick inelastic tissue which wraps on the inside of the skull and protects the brain. It passes out through a hole in the base of the skull and goes all the way down and attaches again to the sacrum, which is at the base of the spine. Now this connective tissue, if it is torqued or twisted from the top, it also then torques and twists at the bottom. So what we're trying to do with NCR is to release the tensions within the dura or the dural membrane and the connective tissues, and to realign the cranial bones by manipulating the central bone of the skull, which is the sphenoid. So the way in which we do this and the techniques we use in an NCR treatment series is we use some external cranial work, and we use our hands to try and slowly slide some of the cranial bones into a better alignment pattern. And this is more like an old school craniopathy technique. So we use various hand positions to slowly slide the cranial bones into a better position. We also do some external body work with the patient fully clothed, led on a massage table. And this is similar to like a deep tissue type massage, and it's got some energetic components similar to some of the Eastern Oriental body works. And then the final part of an NCR treatment is we use very small endonasal balloons or finger cup balloons that we insert very briefly through the nostrils and through one of three passageways on each side into the top of the throat, which we then briefly inflate and as the balloon inflates, it nudges or hits the sphenoid bone, which is the central bone of the human skull, and as the balloon nudges the sphenoid bone, it releases all the tensions within the connective tissue, the dura in the skull, and it realigns the cranial bones into a more symmetrical pattern, moving the patient's whole structure into a more stable, symmetrical pattern, which then allows them to look, feel and function at their best. Thanks for watching.